Welcome back to Alive and Well. I am interviewing Dr. Steven Zonca, and he is telling us all about all kinds of cosmetic procedures, and not just cosmetic. Plastic surgery isn't just about cosmetic. It's also necessity.
The reconstructive
component is necessity, and it's, I think, as women, we sense as we age, we're an aging society now, and we're living longer, and we worry about things like the loose skin, and it's more accessible to us now. We don't have to be Hollywood stars to get a tummy tuck or to get liposuction done. We were talking about tummy tucks, and I'd like to know the difference between going in and having liposuction done in the stomach area or the thigh, any area, versus the actual surgical procedure of the tummy tuck.
And again, tummy tuck is very different than liposuction. There's a bigger incision with a tummy tuck. Liposuction is typically for people who have good skin tone but have a little excess fatty tissue. There typically are diet-resistant areas, the lateral hips, the lower abdomen, maybe the inner thighs. And
what about the love handles?
That's another great area.
Okay.
And those are some areas that they can be diet-resistant. And so with a small pencil-size incision, we can go in and remove that tissue. Again, it doesn't remove skin. One of the real advantages of the laser liposuction that we have available is that compared to traditional liposuction, the laser liposuction has the heat energy of the laser, which can help tighten the skin after the fat is removed, and so that gives us a nicer skin result in the end compared to traditional liposuction.
Now that laser liposuction, that's a newer procedure, isn't it?
It is, and we've recently acquired a new laser, the Cyton Pro Lipo laser, and it works with a liposuction unit. And so what we do is we actually use the laser to melt the fat, then it's removed, and then we use the laser again to go ahead and tighten up the skin after the fatty tissue has been removed.
Now that's not, it says minimally invasive, so
that's correct.
Do you still go under for that, or is it a local?
Most commonly this is done in the office with local anesthesia, and again it's not for large volume liposuction. That would be something that we would still do in the operating room. It's for moderate areas, someone who has a small area, as you mentioned, the love handles, maybe a little area on the lateral thigh. Could
you take it from there and put it on my lips? Which brings me to another topic. When we talk about this laser lipo, this is for Tracy and Connie. I promised them I'd ask. What do we do about this here? Can you lipo out the jowls and the neck?
The laser liposuction can be very effective in the neck, and one of the great advantages is the tightening we get from the laser. Traditional liposuction in the neck can certainly remove excess fatty tissue. It's never usually a large volume, for example, in comparison to the love handles. It's a small volume, but we find that the tightening from the laser improves the silhouette of the neck. And so that we can make
what they used to call the waddle. So you really can tighten
it can be improved. Now understand that it's not a facelift type improvement, and so it's something that on an individual basis we would say either yes, that's something that I think would be you would be a good candidate for, or maybe that we would recommend something else, more along the lines of a facelift. There are a variety of options when it comes to facial rejuvenation. And just from the most basic, we have an esthetician on staff here, and good skin care, sun protection are the foundation of looking good. And we certainly know more today than we've ever known about the potential damaging effects of sun.
Years of sunburn, and I should have never had this face should have never been out in the sun without SPF 50 on it, because I burn, I peel, I'm white. But that's a concern, because I know there's microdermabrasion, there's the chemical peels. I tried a slight chemical peel out, didn't work very well for me, but it does work for some people. My cousin had it done and had wonderful results with a chemical peel, and it also helped with some acne issues. So I know there's different.
Certainly, chemical peels can be very useful for acne and for mild facial rejuvenation with minimal downtime. And there's different strengths of chemical peels, and certainly the more aggressive chemical peels can have some more discomfort with them.
Sure.
We also have laser light therapy, which is also non-invasive and can be very useful for removing brown spots from sun damage, as well as, for example, small dilated capillaries or vessels on the skin. They can be minimized with the use of laser non-invasively.
Is that the same lasers that they use on the spider veins for legs? Is similar? I've heard a lot about that.
Yes, and we have actually 2 lasers that we use for red lesions, vascular lesions, and so we can treat not only the spider veins but the reddish rosacea type skin to minimize the redness with non-invasively. And what we really find the greatest benefit is in the brown sun damage that we see from years of sun exposure. The brown spots can add an aged appearance to the face, and by removing those without surgery or downtime, that it can really make a great enhancement to the face.
I'll bet. Okay. Great segue, because I'm going to ask, pretend I'm a patient and I've come in and I've heard a lot about these mini facelifts. Do you do those here, the mini facelifts? Or
there are some mini facelifts. A facelift is a surgical procedure that you not only remove excess skin, but you tighten the underlying muscle layer of the face. And some of the mini procedures are shortcuts. And so...
And I've heard some things that aren't real. Is it true that there, and I don't imagine you perform those here, but I have heard advertisements for these lunch hour facelifts where they, is it true they put thread or string through the skin that kind of lifts the skin up?
There are procedures that do that, and we consider those shortcuts. And there's certainly a patient, for example, who might not be a candidate for surgery, but it might be a nice option for them. And when we look at facial rejuvenation, we look at a spectrum of facial rejuvenation. We talked about good skin care, minimally invasive things like laser for brown spots, light therapy where there's no actual break in the skin. We then look at just a little more invasive. We look at things along the lines of Botox, which is very effective. There are 2 products on the market currently, both Botox and Dysport are FDA approved. They're FDA approved for the frown lines between the eyebrows, and
up here.
that's correct. And they are also commonly used around the corners of the eyes for the crow's feet, as well as on the horizontal lines on the forehead. And those typically last between 3 to 5 months, and they can make, what they do is they actually weaken the muscle, and so the skin doesn't fold to create creases there. Because
it takes more muscles to frown, kind of thing.
That's correct.
Okay,
that's correct.
The Botox is good for that. Now we have a term among some of my friends. This is we call this puppet face, marionette face. What is short of a facelift? Is there anything to do for the deep lines?
Certainly,
with that
certainly. Facial fillers are used in the lower portion of the face, and we offer a number of fillers, including Radiesse and Juvederm. Those are 2 of our most popular fillers that we use, and the facial fillers have made substantial advancements in the last 9 years. They last longer, and they do a much better job than some of the early fillers we had. Some of the early collagen fillers we had would last 2 to 3 months. Some of the fillers we have now will last up to a year, and those are done right in the office.
Injected? Is it
that's correct, an injection. And typically we would put some topical numbing in the area before, and maybe a little numbing shot in the area before using the filler. And the great thing is with a minimal office procedure, we can make an improvement in the appearance of lines on your face and add some volume that can take many years off the face and can last up to a year. And it's done all in the office with just local anesthesia. So,
okay, and it certainly doesn't involve the cost and the surgical procedure of a complete facelift. Okay, well, that's food for thought. We're going to take a break, come back, and I'm going to ask you to really give me the once over and be honest with me. What would you do with this face? Thank you.